Hello, everyone. Brad Hairston here. Welcome to Transform Now. Today, we are talking about AI in the healthcare sector. And joining me to do this are two experts in the space from Bain Company, Michael Brookshire and Satty Chandrashekhar. Hope I did your last name correctly there. Welcome, gentlemen. Why don't you tell us more about yourself? Michael, why don't you go first?
Great. Thanks for having us, Brad. As you said, my name is Michael Brookshire. I'm a partner at Bain Company. I've been here about 25 years, and I lead our healthcare and life sciences practice here in the Americas. I spend my time with a range of providers, from health systems to physician groups to ambulatory care and so forth, a number of large payers, as well as healthcare services companies. Satty?
Excellent.
Thank you, Michael. Brad, thank you for having us. Satty Chandrashekhar. I'm a partner out of New York. I lead our work for AI insights and solutions, consulting and capabilities for health and life sciences clients. Over the last 2 decades, I've worked with several health services, payer, provider, AMC, and biopharma clients to turn data and AI into real business impact, both for efficiency and for growth-related opportunities. And that's my passion. I help health tech companies, mentor them and also help organizations build high-performing teams and capabilities.
Fantastic. Well, we've had people from Bain on this podcast quite a bit. I think this is the first time we've had guys like you from the healthcare side of things. So really, really glad to have both of you on. And I think we'd all agree AI is impacting virtually everything in business, in society, and healthcare is absolutely no exception. I was reading an article just a couple of weeks ago where Microsoft had talked about their AI health feature. When it's coupled with OpenAI, they're able to outperform practicing physicians in diagnosing cases. They looked at a multitude of cases, and I think they got 80% of them correct. They let human doctors do the same, and they got about 20% correct. So that's just one example of what we're starting to see, quite a bit out in the business world and in the healthcare sector where AI comes into play. So let's dive in. Michael, I'd like to start with you. Now Bain recently published the Healthcare AI Adoption Index, which had some really interesting findings, I thought. Can you talk about where the report said that the fastest adoption of AI is occurring, and then also what's still lagging behind?
Yeah. Well, first, thank you for going to our website and reading some of our documents, or maybe you saw that on LinkedIn. We did recently publish this Healthcare AI Adoption Index. A couple of my colleagues, Caitlin Dowling, Eric Berger, did that. They did it with Bessemer Venture Partners and AWS. And they were really focused on how adoption matches to opportunities. So when you talk to health system leaders, when you talk to clinicians, when you talk to administrators, where do they see the opportunity in AI, and then where are they actually adopting AI? And then we'll talk later about where they're scaling AI. So kind of the classic consulting 2x2 of that. And you mentioned diagnostics. I think that's one place where there's a lot of adoption. You see a lot on care documentation, everything scribes and the ilk. A number of solutions in rev cycle, coding, clinical documentation, things like that. Contracting, you see it in contact centers. The buzzword from, I guess, 6, 9, 12 months ago, agentic, is very real. Really areas where there are just huge amounts of data coming together, and historically you've typically had a lot of manual processes behind that, and now Gen AI and other technologies can be very effective. And so we see that adoption in a lot of places. I think what we aren't fully seeing yet, and I think is the journey to be had, is how to move from that experimentation to real scaling. And so how to take those individual tests, you mentioned one in diagnostics as you open, into things that are being really used on a repeatable and scalable basis, and how, as a company, you can actually adopt AI at scale.
Yeah, that makes sense. Certainly there's a lot of roadblocks that companies are experiencing. And who was it that came out recently and said 95% of projects are failing? MIT with their reports. So a lot of reports about that, about what's holding people back. There very often appears to be something missing. Sati, on the flip side, what are some of the most powerful ways that you guys at Bain are seeing AI actually change healthcare right now?
Yeah. Thanks, Brad, for the question. I think for, just relating to that same MIT report you referenced, the 5% where things are working well. And I'll give you three stories that stand out to us at this time. If we were to just take the payer provider world, one is building on what Michael said, clinical time. It's just snapping back to the bedside. Ambient documentation is being platformed in a big way. Large systems like Montefiore, for example, are rolling out Epic with the Nuance DAX Copilot. And what capabilities like that do is help truly scale the ability to auto draft a visit and just improve throughput across the institution. Epic is productizing scribing. Microsoft is layering in Dragon and even adding specialty models based off of their own work in AI and their partnership. This is no longer gadgetware. This is scaffolding for future workflow that's already in the here and now. I think that's one piece. I think the second is, a regulatory nudge helps. And the way I look at it is administrative friction is now finding value and it's getting engineered into the healthcare ecosystem, right? The CMS interoperability and prior auth final rule, if you really look at that, it puts a clock and it adds an API to how prior authorizations are done. And this is forcing payers to re-platform decisioning and then add transparency into how prior auth is conducted. This could look like summarization of records using Gen AI, pre-checking medical necessity, or even composing determinations. And as long as there are controls, human in the loop style controls to mitigate what the AMA calls black box denials, we think this is going to continue to improve cycle time. And maybe one last example, just the idea of clinical decision support or care decision support getting the power of search. Several years ago, I had the privilege of helping a large AMC, one of the leaders in cancer care, democratize their standard of care by building highly specific solutions using data from within their center, but also from across the network to help general oncologists find treatment recommendations for patient pools that they would look at. If you look at today's AI advances, it leaves things like expert systems like that from even just a few years ago behind in the dust. Institutions like Mayo, for example, are piloting, and they have been doing this for a long time, foundation model search to surface guidelines, to surface notes, but do that in the context of patient care. And I think that's amazing. And when you pair something like that with ambient note-taking, I think it can truly start to shorten the interval from diagnosis to treatment at scale.
That's awesome. And Sati, where do you find health systems are most focused with their AI efforts? Are they looking to help with patient outcomes, cost savings, staff productivity, or something else?
I think that's a really good question, Brad. And our view is, I don't think health systems are necessarily looking at trade-offs between one or the other. They are highly pragmatic. They are focused on what works in which context and how can it be rolled out as widely as possible within the organization, within the enterprise. The easy, low-hanging fruit, if you look across the board for healthcare, is around staff productivity, right? If you, the ambient listening part, there's documentation that I think that's a very clear example. If clinicians, physicians, nurses, other staff love it, is to, how it helps them truly improve their productivity, 15, 20% or more. Then the administrative part of the organization is excited to roll it out and scale it quickly. Similarly, if a large product vendor like an Epic or an R1 or RCM embeds AI agentic workflows into their core product line, the health system is going to take advantage of it. And I think that's what we are seeing in terms of a trend and the way the health systems are actually looking at AI and how to apply it. I think the hard part really is not what the trade-offs are, but how much of a workflow and a workforce redesign are they prepared for and prepared to take on. And we are going to see a spectrum of shift there, and that's what's going to drive adoption and how that, the 95% number moves, as the MIT report, called it out as to, are we going to see more than 5% in terms of return, ROI and value, if you will.
Yep. That makes a lot of sense. Michael, the term active patient comes up a lot these days, where patients are much more engaged and participating in their own care. How is this approach changing the way healthcare providers think about AI-powered engagement?
It's a great question. The active patient is very real, right? I mean, I talk to my health system clients and clinician friends, and they all talk about Dr. Google, and that's been around for, for a long time. I think what's maybe changing now is that AI is enabling that patient to kind of go to the next level. So, we survey patients frequently, we survey clinicians frequently. One of the nuggets that sticks in my mind from a recent survey we did is, I think it's 70% of patients under 35 come into a physician office advocating for a specific therapy. So they've moved from, hey, I, Googled something about, my symptom and I have these ideas, to they're actually going all the way to, here's the therapy I think I need. And that's very different for a physician. That 70% is 3 times the rate of what someone over 65 is asking for. And so you also have this situation where your younger patients are outpacing your clinician who's probably older than them in the use of some of these tools. And so back to a little bit what Satty was describing, if the clinician is not using AI to do their diagnostics, then they're going to be outpaced and they're going to know less than their patient knows. And that's a very different feeling. And it's a very countercultural thing for most clinicians who, grew up thinking they would be the smartest person in the room. And now there's this AI enabled patient that's coming to them. And so I think we're going to see more and more usage on the system side, on the provider side, simply because they need it to stay caught up. I think the longer term implications of this are frankly yet to be determined. I think in many ways, more diagnostics and AI enabled diagnostics are good. Why wouldn't you want to have more information and more data before you're making a diagnosis? I think it's hard to argue with that. At the same time, more diagnosis typically leads to more treatment. Are those treatments actually helpful? It, really depends. There's a lot of factors that play into that. And so I think how this actually plays through the whole healthcare ecosystem over the next several years, I think is a major question that has, it's yet to be determined.
Michael, I'm sure the clinicians love people coming in with an idea of what treatment they already have. I'm sure they're just really excited about that.
Yeah. It really does start to change the way that a clinician practices medicine in some very fundamental ways. And I think it just takes a while for individual humans to adapt in that way. And so the way that these technologies roll out, I think the adoption and the way that workflows change and the way processes change and the way the workforce changes will really kind of play through over the coming years.
Yeah. Earlier, Satty mentioned prior authorization, which certainly is a big pain point, and it crosses over into the payer world. And I know, Bain, you do a lot of consulting to both providers and payers. Michael, how do you see providers and payers deploying AI differently, and which group would you say is further ahead, in your opinion?
Yeah, we're seeing, I think, high levels of adoption, at least the early stage elements of adoption in both providers and payers. I don't think we have many clients who are not at least thinking about AI, not at least trying a few pilots. I think there are some differences in terms of moving from that pilot stage to deployment at scale. In general, payers are a bit further along, I think, than the average provider here, particularly if you move away from very large health systems into, physician offices and so forth.
Yeah.
Some of that is simply because payers have a lot more money. They are bigger on average. They have large tech budgets, and they always have. And so this is yet another technology that they're ready to deploy. I think another part of it is that the core business of the payer is very administrative in a lot of ways. So Gen AI is easy to deploy in that sort of situation. And I think they have less to worry about than your average provider in terms of how does this affect the clinician? How does this affect the patient? Yes, the payer cares about that, but it's a second or third order care versus for a provider. I think the other thing that's really happening now, and we'll see even more of, is the large software companies, whether it's Epic or R1 or Ensemble, or you can kind of go down the list, Oracle, et cetera. As they deploy AI into their software and their technology, that's gonna increase the uptake, because at this point, the health system doesn't need to make a discrete choice on an AI vendor. They're just already using Epic. If Epic is deploying AI in their workflows, it's very easy for them to take advantage of it. And so what I think we'll see over time is an acceleration of deployment, but that deployment will be embedded in some of the key vendors that health systems or payers are using.
Yeah, that's really interesting. Satty, you cannot talk about AI in healthcare without getting into the ethical concerns around bias and transparency and patient safety and things like that. What operating models or governance structures do you see healthcare organizations using to manage this?
Yeah, I think it's a great question. No question, no conversation or initiative around AI goes past its first couple of weeks without this surfacing as a critical priority area. I think, if I were to look at it in terms of just principle, the leaders that are doing this well, Brad, and then maybe I'll answer the question about operating models. They treat this whole notion of responsible AI as some combination of ethics, risk, and compliance. I think that's, those are the ingredients, if you will. But they treat responsible AI the same way they would a care decision, whether it's offering medications or therapy, right? And so the analogy is watching for a indication or a contraindication, looking out for adverse events, calibrating very thoughtfully the dosage, monitoring patient safety. Just apply that to responsible AI. And practically what it looks like, I think it takes 2 or 3 flavors, and I'll just quickly touch upon them. The first and most common flavor is the emergence of some form of an enterprise AI governance council. This is not, the most common model is for this to be tagged on to existing data governance efforts that have been around for a while, and then applying, or kind of combining forces, if you will. These are multidisciplinary councils. Often at a provider, they could look like some combination of medical, nursing, IT, compliance, revenue integrity teams, all kind of coming together into one formal model and council that tiers an inventory of key algorithms that, and key AI solutions that are applied across the organization, risk tier them in terms of how they're defined and deployed, and manage AI evolution from the sandbox at a proof of concept to a supervised solution to something deployed at scale. The second thing that leaders do really well is bake in or build in security by design, not as an afterthought, but truly by design. If we all learned anything from the very public Change Healthcare ransomware effort from last year, I think that had a lot of valuable lessons in data security, how to segment your networks, how to take immutable backups of data that cannot be altered for a period of time, how to authenticate with users coming in. That level of scrutiny has certainly gone up, not just by the enterprise, but also by regulators. And the final thing is, we're starting to see more and more clients look adjacently to other regulated industries and what can be learned from there to work in healthcare. And Bain's often called upon to help think through and bring experiences and lessons learned from that. Banking is a very clear example of another regulated industry, and they've put in place the notion of what you call managing model risk. When I say model, I use that in the context of an AI model. So understanding how that model could drift in real time, roll back when a certain risk threshold is breached, and mandating human in or on the loop, especially when you're trying to make a care decision or a utilization or a coverage decision, could be extremely valuable to learn from, then apply and scale in the context. So we are seeing various versions of all of these archetypes in terms of what operating models are being set up.
Okay. Let me shift gears a little bit. I'm curious, for those that have figured out the governance piece and they've got a good foundation, are you seeing some of the more progressive companies actually create new business models in healthcare? I mean, do you see AI enabling them to create these, or is it too soon?
I'll maybe start that and try to answer that question using the, where is AI reshaping business? I think one of the earlier questions you asked, Brad, using that as a jumping off point. I think we are still early in terms of brand new business models. There's obviously a lot of activity. By our count, there are over 1,000 companies kind of innovating in the space. So I think some of them are going to just inevitably hit upon new business models that work. But if I were to use that earlier question as a jumping off point, I think there are some areas that show potential. The first, if you were to just expand the notion of ambient documentation, right? That's very, you could think of it as a use case being applied and scaled and productized, but you could then expand that and think of the notion of ambient as a service, as a new business model entirely. And any large enterprise-wide deployment is not just reducing scribe time, but another way to think about it is the notion of it's a proof point for creating new unit economics for visits. And that, if you were to extrapolate that, could create new staffing models, extended hours. It's a matter of time, I think, before somebody scales this beyond how the AI is being applied to just scribe in the background and truly change that in terms of optimization of staff and how deployment is done in a healthcare institution. I think the second is prior auth is where a lot of the activity is. But if you were to just expand that to all things utilization management, I think there is opportunity there. And with, the CMS timeline and prior auth rule and companies' own investments in exploiting AI for faster approvals, I think we are going to start to see some combination of payers, providers, and, very nimble health tech partners, vendors that are going to be able to transact these requests, both with explainable, responsible AI and also auditable evidence. And I think there is opportunity and significant potential there for new models where businesses are going to monetize speed, transparency, and overturned rates as their differentiators. And then the third could be the notion of health data or health insight exchanges. So foundation-rich models, we talked about that. Think about that AI on top of clinical claims, perhaps social determinants of health data, using that as a business service that can provide second opinion consults, or if it's an care delivery institution, tumor board prep, risk scoring and stratifying patients. But the difference would be that you're actually pricing these services on outcomes, not on software licenses. That I think is very interesting. But these types of health data ecosystem plays, they have been tried. I personally think the time has come for them to start to scale. As long as the right incentives are in place as to who's participating in the ecosystem, there are rules for IP sharing. And importantly, there is an honest broker, a convener that brings different parties together. I think this will continue to evolve as a business model. This change from value chains or looking at it from left to right to ecosystem place where there's two-sided value creation.
I think maybe just to add a couple of things, I agree with all of that, Satty. And I think that because the healthcare ecosystem is so complex, there have been many, many businesses that have been created that are really services businesses that are going at individual point problems and trying to solve them, often with people, sometimes with some technology behind it. And AI really enables a total rethink of that. And it kind of this question that Satty is raising around ecosystem versus value chain. Are there new ways for organizations to play? Are there ways for them to actually truly get paid on the outcome they're creating versus, the process or the click that they're doing? I think the other question, which is further away, is at what point and in what aspects are you going to move so the human is not in the loop anymore? There is no human in the loop. And I think most of our health system, all of our health system clients and most of our other clients in the healthcare ecosystem are very intentional today about using AI, but with the human in the loop. And there's a question of whether that can evolve. So, what is the Waymo of the future in healthcare? Is that a thing? Is it going to happen on, we haven't talked, much about pharma or medtech, but is it drug discovery? Is it clinical environment? Is it diagnostics? Do you actually have can imagine a humanoid robot doing diagnostics using AI? Wow, that would be really revolutionary, right? People aren't anywhere near that today, in real life at scale. But I think one day the technology will get there. And so I think for our clients and for organizations, there's this question of what is that future back potential of what could happen? And then what is the today forward? And I think what's exciting about Gen AI is there's so much opportunity with the technology that already exists and is being deployed to some extent, whether it's the ambient example, the prior auth example, the co-pilots, all of these things are really powerful, and provider space and the payer space are low margin businesses. And so if you can deploy some amount of these technologies at a reasonable level of scale, you can get enormous value back to your organization and then ultimately back to the patients you're serving. And so I think that's why Satty and I are really excited about some of the things we've been talking about today.
Yeah. I find all three of those new business models very fascinating, especially the third one, the data and insight exchanges. I think per the active patient chat that we had a moment ago, it feels like that's something that is just that it's the right time, that consumers in general would love to have the ability to get a second opinion or just make sure that, the course of action that a doctor is taking with them is the best one. So I think that is one that could take off really fast. Michael, let's talk about ROI. So ROI gets a lot of attention when it comes to AI. There's a lot of companies that do POCs and pilots and what have you, and they just don't end up with the returns that they were after from the very beginning. So from the Bain perspective, what indicators do you think healthcare executives should pay attention to understand if their AI initiatives are truly moving the needle on patient outcomes and financial performance?
Yeah, it's interesting that you mentioned that. As we kind of started this conversation with where's innovation happening. One of the things I mentioned is there's lots of innovation. There's not always a lot of scaling. One of the biggest factors holding scaling back is that organizations are not very good at measuring the results that they're driving, particularly when you move from measure the results of an individual pilot to actually tracking something at an enterprise level. And so even on some of the things that are easier to track, like productivity, it's very difficult for an organization to take the productivity that's coming from ambient listening and actually see any benefit at all when they think about the aggregate productivity of their workforce. And then certainly if they want to tie that through to their cost position Are their costs actually going down, or are they just redeploying that work to, that time to other things that aren't helpful? And so I think this is the core question for a CFO, which is, what are the metrics that they need? I like how you posited it, that there's a set of metrics that are financial, both revenue and cost, but then there's also ultimately a set of outcomes metrics for patients and for clinicians. Yeah. Some of those might be satisfaction related, like NPS. Some of those might be health outcomes. Some of those might be access outcomes, et cetera. But what are those metrics that you're going to lay out for the enterprise? And then how do you track from the individual pilot that may be generating results to something happening more systematically across your enterprise?
Yeah, absolutely. Satty, let me wrap up our conversation today with you. So as Bain often advises clients on strategy before technology, what are the strategic questions that you think every healthcare executive should ask before launching a major AI initiative?
I think it's the question of these times. Our colleagues at Bain, Sarah Elk and Chuck Whitten, recently wrote about how companies can unstick their AI transformations. I think there's a lot of valuable insight there. If I were to borrow a couple of themes from that and the comment Michael just made in response to your last question, there's a short checklist of things that keeps coming up over and over, both with clients that are doing this really well. We call them leaders, and clients that are not doing this well. And it's very apparent that there's a misstep in one of those. I think the first most important one is, I think, what Michael touched on. Where is the value? Whether it's for the enterprise or for the patients, depending on your context in the healthcare sector. If, as somebody that's sponsoring your AI initiative, you can't name the P&L line and or the care metric that you're going to be able to move, not in 18 months, but in the next 2 quarters or 3 quarters. This could look like a length of stay change or a denial of overturn, metric improvement. If you can't name it, don't fund it. That's what we have to offer. I think the second is organizations should ask themselves the question, who the economic owner is. So, and what that translates to in real terms is one accountable executive per domain. Too often what we see is diffuse accountability spread across the enterprise. And the leaders that really do it well, they could empower execution in a decentralized manner, but the governance and accountability is always centralized. I think the next is, and this is one of the hottest topics right now in the industry in terms of discussion, what is going to change in the workflow and the workforce? You can't just drop AI technology in. You have to redesign the roles, the schedules if they apply, the job aids that you give, the upskilling that you do, and how that, those handoffs occur across, the end-to-end process, if you will, where you're trying to effect the change, if it's within one or multiple functions in the enterprise. You have to be able to, measure if it's savings that you're tracking and how you're redeploying it, or redeployed time, not just what you're saving. The next is, should you build, buy, or partner? We see organizations at 2 extreme ends of the spectrum. I think it's instructive to see that AI has suddenly made building useful things very accessible and often very affordable. But should you build or should you partner? When you look at many of your technology partners and their own roadmaps as they're starting to come out with agentic workflows baked inside them, you have to very thoughtfully look at, thoughtfully but expediently look at the cost of switching or the cost of an exit. The spectrum ends are an analysis paralysis where you don't make decisions, or rapid decisions, in a highly decentralized manner that ultimately leads to duplication of efforts and runaway costs. I think the answer is to balance that quickly. I think the next is the AI evolution has put a strobe light on data readiness across enterprises and organizations. So you do really need to, ask, how ready is your data? And there are many rubrics. Fair, findable, accessible, interoperable, reusable is one such rubric that we are seeing a lot of clients talk about. But the point is that you have to truly assess your data readiness for your AI to function and work effectively. It is possible, and there are many studies that support this. Up to 70% of your next AI effort could actually be in your data prep for, to make your AI work in the organization. And maybe the last one is leaders that do this well scale, have a scaling plan in mind, and they've kind of figured out what that rubric is. And and this is not some elaborate plan. This is truly just identifying the triggers, the exit criteria for going from POC to pilot, from pilot to MVP, from MVP to scale. And this could look like, a 20% improvement in your target performance metric. It could look like 0 adverse safety events if you're deploying something that touches patient care. It could look like over 75% adoption in the set of users that you're going after. Whatever that rubric is, you should define it earlier, not define it as you go along. You should obviously monitor it as you go along, but defining that truly gives you a North Star and a direction to point at. And so when we see leaders do this well, right, and when they launch their AI initiatives that succeed, the 5%, if you were to really hone in on the MIT report, they're doing most of these right.
Yeah. Those are outstanding. I think I agree with you that the first one may be the most important, and it's one that too many companies skip past. They just want to rush in and do a AI project without really thinking about, where's the value? What are the outcomes I'm trying to achieve? And make sure that is crystal clear. I would also argue for a healthcare provider, it better tie to patient outcomes and making life better for the patient. But those are all really, really good questions. I think our listeners are taking note and taking heed of these things. They could avoid them, help them avoid a lot of missteps as they enter this space. Well, Michael and Satty, it's been really great having you on. We gained a ton of insights from both of you in this conversation. It's fascinating to see how quickly healthcare is changing, and it's going to continue to change. I mean, the innovation is really, I think, just begun. So thank you for being on today and sharing kind of what you see from your perspective. I'm not surprised to see Bain, right on the leading edge of what's going on. So appreciate you being here, and I wish you both the very best.
Thank you for having us, Brett.
Thank you for having us, Brett. This is great.
Bet.